Health Canada has approved an updated Moderna COVID-19 vaccine to target an Omicron subvariant. It's authorized for use in people aged 6 months or older. And today, Chief Public Health Officer Theresa Tam stressed the importance of vaccination heading into the fall and winter.
We are absolutely encouraging people to get protected, both with COVID-19 vaccine and the flu shot, prior to the period ahead.
Tam went on to say that in the last few weeks, there has been an increase in COVID-19 indicators. Deputy Chief Public Health Officer Dr. Howard Njoo joins me now. Dr. Njoo, good to talk to you again.
Hello there.
So this vaccine is approved for people over 6 months, but who should be lining up to get this vaccine?
Well, the thing is, as you said, it's approved for anyone over 6 months of age. So I think, in principle, everyone who's eligible should probably take advantage of it. But I would say that especially for the young children, I think parents should have a good discussion with their pediatrician, obviously, to look at the risks and benefits and make an informed choice. For the others, I think, especially if you're in an at-risk group for more severe consequences, I think, as they say, it's probably a no-brainer. We said for the last 3 years, for the vaccines that, those over the age of 65, if you are living in sort of a collective living arrangement, if you're, let's say, immunocompromised or have underlying medical conditions, if you're a part of, let's say, an indigenous population, be it First Nations, Inuit or Métis, it goes on and on. Those individuals, obviously, I think, are at higher risk of consequences and certainly should take advantage of the new vaccine that's available.
In the past, when we saw these new vaccine approvals to deal with new variants or just get to the booster shots, there was an urgency in the population that's not quite there right now with the way COVID is playing out. So how do you get the message out to people that they might need it when there's kind of a fatigue that's setting in, perhaps?
Yeah, I can appreciate that when you say there's a fatigue setting in, but what I would say is that all of us recognize that every year we've got, respiratory viruses, especially with the winter season coming up, with the flu and RSV now and so on and so forth. So I would say that, it's in everyone's best interest to be as prepared as possible in terms of what prevention they can take. And so therefore, I would certainly recommend that when you go out there, it's not just because of COVID-19 that you should get the updated vaccine, but as well, at the same time, get your flu shot, when that's available as well. And then, of course, all of the good public health and, I would say personal protective measures that everyone's well versed in, I think that will serve us all in good stead, because we saw last year there was obviously a lot of pressure, or even the past 3 years in our healthcare system. The more that each of us can do in terms of our personal behaviors, the choices we make. For example, I think even mask wearing, I think, is coming back in vogue. People get it. It's a way to protect yourself, but also maybe your loved ones and others are more vulnerable in our community. That might be a good idea as we get more indoors. As the winter season approaches, that all these things put together would hopefully lessen the need for people to have to end up seeing a physician or going to the emergency room.
But it's interesting watching your press conference today. I saw you, Dr. Tam, Dr. Sharma, who we used to see practically every day not that long ago. You were distanced at the press conferences. You were wearing masks. When I'm out and about here in Ottawa, I did some air travel recently. You don't see the masks. You don't see the distancing. So how do you encourage people to get back to that point, given just where things are right now?
Well, I think, what we've been harping on for the past 3 years is, in English, we call about the 3 C's, right? If you look at the environments, whether it's, it's crowded places with close contact, and especially closed spaces, especially, as we head into the winter season, then it's a good idea to think about what you can do to not just protect yourself, but others. And certainly if you're maybe at risk for more severe consequences, maybe it's a more of a, let's say, an easier choice to make, and maybe compared to others. But I would say that, any one measure in and of itself, it won't be the perfect solution. But if you combine that with, good hand washing sort of regularly, as well as maybe indoors looking at your ventilation system, see what you can do to improve that. Obviously, I think a good practice we've all picked up is that, hey, if you're sick, stay at home. Don't put others at risk by going out to, to that party or that social event or going to work. So all of those things put together, I think, is really what's going to, I think, help us all, each every one of us, as well as the healthcare system.
But what advice do you have to people who maybe no longer consider COVID to be a serious issue, that it's become more of an inconvenience if you get it? People have had bouts of it, and they were just had a mild flu for a couple of days. It's not the health catastrophe it was in, say, 2020 and 2021. What advice do you have for them to get back into that mindset?
Well, the thing is, unfortunately, the virus is still here. It's still circulating worldwide, and as we know, the variants keep coming up. The virus is smart; it keeps, as they say, evolving and looking for what they call it, a transmission advantage, or maybe looking to evade our immunity either by the vaccines or even what we call from a previous infection. And so, what we're seeing now is that for the moment, things are fairly stable across the country, but you can see that hospitalizations have continued, and they're starting to creep up in certain jurisdictions. And if you look at what's happening around the world, I think we all recognize that COVID is going to circulate for quite some time. And then, of course, with all the other respiratory viruses, put that all together, if we don't take the right measures, both individually and collectively, then we might be in for a worse situation.
So what kind of an uptake are you hoping to see? I know we had aggressive vaccine targets when we were pushing for kind of a herd immunity thing to deal with the real acute phase of the disease. What are you hoping to see with this specific Moderna vaccine, for example, as it deals with Omicron and that variant? What kind of a vaccination rate would you like to see in Canada this fall?
Well, it's difficult to say because obviously I think, in terms of any target, you set yourself up for maybe, sort of managing expectations. What I would say is that certainly for certain at-risk populations, those in congregate living centers, seniors and so on, I think, we're as high as possible in terms of a vaccine coverage rate. And certainly when I've been out in the neighborhood, I've noticed, the seniors, for the most part, they're the ones who are really continuing to practice all those good personal protective measures, wearing the mask, et cetera, when they're in the grocery store and so on. So I fully expect them to be sort of on board in terms of being up to date with the latest vaccines. I think for the younger folks and so on, it might be, as you say, a harder sell. But the one thing and this is something that I don't know, no one knows, is that what about long-term consequences? People still talk about and are learning about what long COVID is. Some individuals are having a fogginess, some other obviously problems, many months after they've had their initial bout of COVID. So that's something to keep in mind. And certainly we've seen from the limited evidence to date that there is some evidence out there that shows that having had a COVID-19 vaccine can help mitigate against potential long-term effects.